When given a diagnosis of cancer, you know there will be a treatment plan, but you still wonder, is there something else, possibly something better you could try? And there might just be. Dr. Joanna Burrell is here to prescribe the benefits of participating in a clinical trial. Dr. Burrell is the Associate Cancer Center Director for Clinical Research at Metro Health. Welcome to the show.
Thank you, Lori.
So I know that there are many clinical trials out there going on, for all kinds of different things, like hypertension and diabetes, but these are specifically for cancer clinical trials. So how did they begin?
Well, there's a great need, as you know, to find more effective therapies. Scientists are always looking into improving the treatments that we have. Even in cancers that are curable, such as Hodgkin's disease and early stage breast cancer, there's a need to find treatments that are less toxic, meaning people have less side effects from the treatments. And that's important as people survive these cancers and won't be affected by the side effects as they go on.
How does the money come about for them?
Usually from the National Cancer Institute. That's one important place to get money for research. Pharmaceutical companies will also sponsor their own trials. And then investigators, such as people at centers like Metro Health, will write their own trials.
Okay, so how do patients know to sign up?
Well, they talk to their oncologist, and their oncologist is usually one who recommends that they go on a clinical trial because the oncologist knows their cancer type, their condition, and what clinical trials are available. The oncologist tries to make a match to see if the patient fits the criteria.
Okay, is there a way that people can search it out for themselves even?
They sure can. They can go on cancer.gov and look for clinical trials in the area, but also just ask your physician.
Okay, sounds easy. So if you're in a trial, is there any chance that you're going to be on a placebo, to compare nothing to the trial cancer therapy that's being tested?
Well, that's a really good question. So in the common cancer trials, treatment trials, you're testing a new drug versus the standard of care. So you are randomly assigned to either one or the other. So you're always getting treatment for your cancer. Some trials give everyone the new treatment, and there's other trials also there's trials that when there is no standard therapy, you might be assigned a placebo. So for instance, if we're looking at preventing a certain type of cancer and there's no therapy for that, it's right to give someone a placebo.
Okay.
But those trials are not common.
Okay, so normally you're in some kind of a treatment group, so they can tweak what's going on with you, just like you're getting just regular treatment?
You'll find that when you're in a clinical trial, it's just like regular treatment. You get the same CAT scans and assessments that you normally would. The physician's always looking to see if the treatment's still working for you or not.
Okay, so if you meet the criteria for a trial, either referred or you find it,
yes.
and you ask to get into it, what are the commitments that you have?
So you do have to commit to a schedule. So the trial will say you need your blood work and your MRI on Tuesday, and you need to commit to be there. If your treatment can only be done on Thursday, you need to make arrangements to make sure you can get treated.
Okay.
You can always stop a clinical trial at any time if you find it's just not working out for you.
So what's the advantage then, getting into it?
There's several advantages, and the two most important to me are, first of all, you're getting extra attention. So you have a clinical trials team that's working with you, and extra attention is always good.
Always a good thing, especially with cancer.
And then a lot of people enter clinical trials to get better treatment, but you're also doing something for the people down the line, and you're really helping others that will come behind you to decide what would be a good new treatment.
Yeah, and that's a noble thing.
It's a
help
very
yourself
noble
and help
thing.
everybody else at the same
Yeah.
time. So the trials of cancer can be lifted a little, knowing that taking part in a clinical trial may help not only you, but others. To learn more or to see if you're eligible for a clinical trial, ask your physician or use the number that's coming up next. My thanks to Dr. Burrell for joining us today.
Thank you.
To learn more, call Metro Health at 216-778-7800 or log on to www.metrohealth.org.